to introduce our speaker for today, Jill Anderson. Jill is a registered dietitian at the Wellness Institute here in Winnipeg, and a lot of you might know her already from the pulmonary rehab program you've gone to. She has 10 years of experience working as a dietitian in the areas of chronic disease management, women's health, long-term care, and obesity care. Jill provides one-on-one nutrition counseling services at the Wellness Institute Clinic and is also involved in the risk reduction and weight loss clinic, as well as their pulmonary and cardiac rehab programs. She is passionate about empowering people to achieve lasting health outcomes by helping them integrate practical nutrition and self-care habits into their lifestyle. Today's topic is healthy eating for people with chronic lung disease. Welcome, Jill. We're excited to hear from you.
So some of you maybe recognize a couple familiar faces out there, but I am involved over at the Wellness Institute in the Pulmonary Rehab program there. So thanks for having me. So I'll go through the slides here. We're going to talk about the nutrition piece with lung disease, and really just want to encourage you to ask questions as we go. I'm happy to kind of keep things informal, and if any questions pop up throughout the presentation, feel free to ask as we go along, and we can kind of discuss the questions as we go. Or if you want to save them till the end, there will be time for questions and discussion at the end as well. All right. So some of the objectives we'll go over today. We're going to talk about just the role of nutrition and how it can help optimize and improve quality of life when living with lung disease. We'll review some general healthy eating patterns, talking about meal spacing, and also sort of the what and when and how to eat as well. Talk about some meal balance. And then we'll go through some practical tips and suggestions. We can go over how to manage some side effects and, really just get the most punch from our food, get the most out of our meals. So we'll go through that. All right. So nutrition, really important for so many different reasons, but when living with lung disease, it can be really helpful in preventing and fighting infections. So we really need to make sure we're optimizing diet, getting the nutrition that we need to help set our bodies up for success with fighting infections. And then food, of course, will also play a role into some of the side effects too, and in how we manage our side effects. Nutrition also important in maintaining our strength and our muscle mass and our energy levels. So in the little picture here on this slide, just kind of goes through a little bit of a cycle that can happen if we do have poor nutrition. Can lead to just overall weakness, reduced energy levels, increased illness, reduced immunity. So it can be definitely a bit of a cycle, can lead to, our poor energy levels contributing to our inability to keep moving and keep physically active, and then again, contributing to reduced strength and energy. Okay, so we'll just kind of go through some basics about healthy eating and how to kind of get the right balance with our meals. So you may have seen this before. I definitely do show it in the pulmonary rehab program. And really this balanced plate is something that dietitians love to use as an education tool for many different reasons. We use it in blood sugar management, in heart health management, just general healthy eating. I also use it in our weight loss clinic. So this picture, maybe you've seen a similar version in the past, but it's really a practical tool to help to balance your meals. So just quickly, I'll go over it, but we want, ideally, in a perfect world, we want to aim for about a quarter of our plate being starches, and I'll go through kind of each of these in a little bit more detail. And then we want to make sure that we're having some protein foods with each meal as well. So this can be a tricky one, and we'll talk about that, but lots of different ways we can get protein in. Doesn't have to be a big piece of steak like in the picture. If it is, that's okay too. And then we want to aim for Lots of vegetables, fruits and vegetables, lots of protective, anti-inflammatory properties in those foods, and they're often the first ones to get left behind in our meals. So we want to try to include those, working toward a half a plate. And keep in mind, this is the gold standard. I know that not every meal is going to look like this in real life, and that's okay. But it can be a helpful tool just to kind of do a quick check on your meals and just sort of see if maybe there are some patterns or maybe some specific pieces of this that might be missing. And then also we want to include high calcium foods too. And this is another missing piece a lot of times that I see. So we'll talk about that a little bit more. So we will start with protein. So I think a lot of us are aware of the benefits of protein. We know that it's necessary. It's something that people are mindful of. There's a lot more talk about it in the media or in the diet world anyways. But protein foods are important. So we do need them for lots of different reasons. High protein, having a source of protein in your meals can really help for you to get enough. And we do need enough protein to help keep our immunity up, to help keep our strength and our lean muscle mass. So protein foods, like I said, not just meat, they can come from plant sources as well. So ideally, we're having a combination of plant and animal sources, or can also just be plant-based if that's what works for you. Yeah, I think I see a question over here. Yeah.
What's your thoughts on protein bars as a supplement throughout the day?
Yeah, great question. So the question, just to repeat for anyone that missed it, but the question is, what are my thoughts on protein bars as a supplement or throughout the day as a snack? So yeah, great question. Protein is a tricky nutrient to get enough of. So sometimes supplements are very helpful. I think the thing is it is a bit individual and nuanced, as with most things diet-wise. We wouldn't want to be, eating a protein bar or drinking a protein shake, before a meal if we're already struggling with poor appetite or like a lack of appetite, because it's going to fill us up and it's not going to be as, good as having a meal. So we wouldn't want it to take away from your meal, but I think it's a helpful tool to, keep when you're on the go, or if you don't have time, or if that's kind of all you can manage. Yeah, there's certainly a wide array of them out there as well. So quality of protein bars would be important too. But yes, supplements can absolutely be a helpful tool. So yeah. Are they necessary? No, but certainly can be useful. Okay, so yeah, I was kind of talking about different types of protein foods. So meat products, so poultry, chicken, fish, for sure, eggs, really, really good quality sources of protein. And then we have our plant proteins as well, which are also really good, and often they can be unfamiliar. We don't know really what to do with them a lot of times, and we're not comfortable cooking them, but they are really good quality sources of protein as well. So things like beans, chickpeas, lentils, our legumes, also our nuts and seeds too, really good sources of protein. And soy-based proteins as well can be really helpful and really good quality sources. Okay, so we kind of talked a bit about the benefits of eating protein foods and why we need them. So just generally to support our overall health, our wellness, to help get lots of good iron in, which we'll talk about as well. If ever you have any wounds or any infections that are you're having a difficult time healing, one of the good sort of nutrition strategies for that is to increase your protein intake to help with that wound healing. We need that nutrition from protein to help fight infections and heal wounds. Also helping you to feel full. So that can be a bit of a balancing act if you're feeling full really quickly or if you're experiencing a loss of appetite. But one of the benefits of protein is that it helps sustain us. It helps us stay full and satisfied until our next meal. Also plays an important role in blood sugar management too. So pairing our meals, including a source of protein, can be it's a really important thing in optimizing our blood sugars. So we do want to be able to get enough protein, and to reach your protein requirement, which is different for everyone. We want to include protein foods with each meal and snack. It can be really difficult if we're only having protein at one meal or 1 or 2 meals in a day. It's really hard to get enough protein and to meet your requirements. So we do want to include protein, at least at every meal, and ideally with snacks too. And that will help you increase your odds of meeting your protein requirement. Any questions on protein? Yeah.
What is the ideal number of protein?
Yes, good question. So protein requirement, the question is, what is an ideal amount of protein? So there are so many different factors that kind of go into that calculation. I think it depends on a lot of different things. Like on a basic level, it depends on your age, your height, your weight, your activity level. But then there are also other things that can come into play as well. Like if you maybe have some reduced kidney function, or if maybe you have a specific healthy eating goal, or if you have blood sugar control goals. So protein requirements vary. So there's certainly not a one size fits all. So I think, I can't really give an exact number on it, but if you want to come and chat, it does kind of require a bit more of a individualized answer. But I think that's where, just trying to think about each meal, and do I have a good quality source, and is it about a quarter of my meal, and then that'll assure you that you're getting close probably to your requirement. Yep.
Can we say that beans are beans, or are there some varieties that are better than others?
Yeah, great question. So the question is, are all beans a good source of protein, or are some beans better than others? So that is a great question. So they do vary slightly with their protein content. So I think the first thing is something like a green bean, that falls more into the category of non-starchy vegetables. So I wouldn't consider green beans a protein source. But when we're talking about chickpeas, kidney beans, like pinto beans, black beans, and lentils, edamame beans is another one. They do vary slightly. Some of them are a little more starchy than others, but they're all pretty good sources of protein. Edamame beans are ones that are maybe a little bit higher, but all really, really good sources of protein, and also iron, which is something that we, sometimes overlook. And also they have really good fiber in them, which we'll talk about too. So any of them are good. I think, you might use certain ones just depending on the meal or your preference or your recipe, but a good variety is always good. Any other questions on protein? Okay, we'll move on to iron. So I kind of mentioned this a little bit already, because a lot of our protein foods, not all of them, but a lot of our protein foods are also really good sources of iron. So iron is a very important nutrient because it helps to carry oxygen throughout our body. So low iron levels is something to watch out for. It can be a reason why we have a lower energy. Not always, but it's always good to look into it and see if that may be playing into if you're experiencing a low energy or a reduced energy. It can contribute to a reduced immunity as well. So iron is an important nutrient that we can get from food. Sometimes we need an additional supplement, but generally, if we are eating a good variety of iron-rich foods on a daily basis, we shouldn't require the supplement unless you have a history of a deficiency, which we can only tell by meeting with your physician for and drawing some blood and looking at the blood work. But foods that are high in iron, again, they're the beans, the chickpeas, our meat sources of protein. So beef, chicken, fish also has really good iron in it as well. And some foods like grain products are also fortified with iron as well. So that can help to bump it up too. So there are some plant foods that have iron, and there are animal sources of iron. Our bodies do prefer the animal types of iron. It is just more well absorbed versus the plant sources. So that, in other words, the meat sources are better absorbed than sort of the beans and the chickpeas when it comes to iron. So if a low iron is something that you're struggling with from a dietary perspective, animal sources of iron are going to have more sort of bang for your buck, essentially. Any questions? Yeah, it will have some iron in it, but it's one to be cautious of because it is very dense. And just making sure, like, especially if you have any concerns with kidney function, it might not be a recommended source, but yeah, it does. Liver. The question was, does liver have iron? Yeah, it does for sure. Yeah, another question back there?
Iron wouldn't be on a routine blood test with your doctor. It's something you would have to ask your doctor to test you for. Is that correct?
Correct.
Yeah. So it's something we might not think of asking our doctor to test for. How's our iron level? Is it worth doing that at least once a year?
I think if you're experiencing symptoms, like maybe a sudden change in energy levels, and you don't really know the reason for it. Also, like sometimes when I'm meeting with somebody and doing an assessment of their diet, I can get a sense of if they might be at risk of iron deficiency. Or if you're somebody who follows more of a plant-based diet, then you are more at risk for some iron deficiency there as well. I mean, it's certainly something that with some proper planning, it can easily be managed. But yeah, I think there are certain risk factors. And so if you are concerned about it, yeah, you can absolutely talk to your doctor about looking into it through your blood work. Yeah.
We live the joy of not having enough oxygen in our blood all the time. Sometimes looking on an oximeter to get the blood oxygen levels. Would the amount of iron in our diet also be reflected with our O2 levels with something like an oximeter?
I don't know if I can exactly answer that question. I think it's hard to say. I think there's probably multiple factors at play, right? So I think, again, like looking into your blood work would be the best way to tell. But yeah, the thing about iron is too much is also not a good thing. You don't want to supplement just because you suspect that you have low energy. You don't want to just start taking an iron supplement because, like, if your iron levels are too high, that's not something that we want. So we have to be careful with that, and definitely under the guidance of your physician. Okay. Any other questions? Just one more note on the iron thing is that when you do pair iron-rich foods, such as the ones in the picture there, if you pair them with a source of vitamin C, in other words, a fruit or vegetable, then that iron has a better absorption rate. So that's just one little sort of note on if you are trying to optimize iron in your diet. Eating it with a source of vitamin C, fruits or vegetables, can really help to absorb your iron. And another reason where it goes back to that balanced plate too, where that's part of the rationale behind that plate is having a variety of foods with each meal does help with the nutrient absorption. Okay, we'll move on to starches now. So starchy foods, sometimes called our carbs or our carbohydrates, they are our body's preferred source of energy. They're an energy powerhouse. So these foods sometimes get a bad reputation, and that's, I think, because there's a wide variety of quality of carbohydrates. So we'll talk about that. But they do provide our bodies with a quick source of energy. They can be really, really good sources of fiber. Again, something we'll talk a little bit more about, but we'll go through the starches. We want to aim for about a quarter of your plate as a starch. So starchy foods, I guess I didn't go over that, but corn, it would be considered in the starch portion of the plate and not the vegetable portion. Same with potatoes. And so more of our starchy vegetables, those would be carbohydrates. They would go into that quarter of the plate. Also breads, pastas, rices, and then there's a lot of processed carbohydrates as well. So again, they are our body's preferred source of energy for our brain and our muscles, good source of fiber, and we do want to include these foods with each meal as well. It's just if we have concerns with blood sugar, we want to be mindful of the portions of these foods, and we also want to be mindful of the portions so we can save room for the fruits and vegetables and the protein foods as well. So if we're filling up on carb foods, we're likely eating less protein and vegetables. Any questions on the starchy foods, the carbs? Yes. Okay, the question is, would a sweet potato be considered a starch or a vegetable? It's a starch, for sure. So it has some of the benefits for sure, like some vitamins and minerals that vegetables have, but it definitely is still a starch. I think where we have the idea that it is a healthier option than regular potatoes is because of how it affects our blood sugar. So it's lower on the glycemic index, which is a whole other topic, but basically it's more blood sugar friendly than a regular potato. And that's where the kind of benefits from there. And maybe some differences in there, like vitamin and mineral content as well, but still a starch. Yeah, another question? Yes. So the question is, would you consider it to be a high fiber starch because it does slow down the absorption of the sugars? Yes, absolutely. That is in part due to why it's a better option, is because it's higher fiber, and that's where it's lower on the glycemic index. It's because it doesn't spike blood sugar as fast. So yeah, it's got good fiber. Regular potatoes have good fiber in them as well. They just tend to spike our sugars a little bit faster. So the question is, the starches tend to be the more fun foods. Yeah, I definitely don't disagree. So what would be considered some of the healthier options? So anything that's higher fiber. And like just thinking about whole food sources of carbohydrates. So choosing the less refined option. So I think a good comparison is like a nice grainy, like higher fiber bread versus a white bread, or like a brown or a wild rice compared to a white rice, a whole grain high fiber pasta over the white pasta. So I think the reason that is again, it goes back to the fiber. So we want to choose those high fiber carbohydrates for so many reasons: for blood control, blood sugar control, and also for our digestive health, to make sure we're getting enough fiber. And that fiber, which we'll talk about, also plays a role into our heart health and our cholesterol too. I'll just add that the fun foods can totally fit, but we just don't want to fill up on them too much and then, sort of miss opportunities to get some of that nutrition that we want. So we'll talk about that as well. So fiber, this has come up a few times already, and it always does for good reason. So fiber, I think a lot of times when we think about it, we think of our gut health, right? Oh, fiber, yeah, I know that's good. That's good for my digestion. But we maybe you don't recognize the other benefits of fiber too. It really plays a role in heart health, and it can help to lower our LDL or our bad cholesterol. And also plays a role in blood sugar too. So fiber comes from plant foods, to put it as simple as possible. And then if those plant foods are more refined, so they're more processed, then that sort of strips away the fiber, right? So another example would be fruit versus fruit juice. So the juice has the fiber stripped away, so it's just really left with some of the vitamins and minerals, but just a lot of the sugar. So we want to eat them in their whole food forms. So nuts and seeds have good fiber typically. Again, our beans and our legumes, our fruits and vegetables, our grains, like I just talked about, the higher fiber starches, whole grain breads, whole grain pastas, brown rice, wild rice, quinoa. So more plants equals more fiber. So trying to get our fiber from our food first. However, there are some really great supplements out there if you're struggling to get enough fiber. So any questions on fiber? Yeah. Oh yeah, oatmeal. I didn't mention it, but yeah, it would fit into the starch category, but it is a really nice high fiber carbohydrate or starch.
Would you recommend a type of oatmeal versus just plain ordinary?
Yeah, so that's a really good question as well. So like anything, oatmeal is a really good high fiber starch, but like anything, there's a million choices of oatmeals in the store, and a lot of them are quite refined too, and they have a lot of added sugars to them. So I think what I typically recommend is like somewhere in the middle, like a large flake or like a rolled oat, because it doesn't take forever to cook, like a steel cut oat, which is good, but it takes so long. It's not necessarily super practical, and some people don't like the taste of it. So a large flake oat cooks quite quickly, and it doesn't have any of the added sugars. Like the little packets, they'll always have a lot of added sugar in them. I think there's some that don't. And that's okay. We can have some sugar in it, but better to maybe add your own, and sort of that way you have more control over it. So yeah, oatmeal is a good, nice high fiber starch though. The question is, yeah, what about Metamucil? Yeah, really good source of, it's a good fiber supplement. There's so many different ones out there. Metamucil is the one that everyone knows. It's been around the longest. It's a psyllium fiber, so it's just a type of soluble fiber that is really good for our cholesterol levels and as well our digestive health. So yeah, I often do recommend it. It's an easy thing that people can do, especially if you're routinely coming up short for your fiber, or you're having any gut health challenges, or if you have cholesterol concerns. Yeah, it's something I recommend pretty often. Definitely not, again, just like the protein bars, the purpose is to supplement, right? It's not something that you absolutely need. It's not a must have, but it could be a helpful tool. Cinnamon pills is the question. What about cinnamon pills? So I think there are so many different supplements out there, and they're not all super like highly regulated in Canada, unfortunately. Something like a cinnamon pill, I mean, I think, do we have enough evidence to support the claims? Probably not. However, it's probably pretty harmless if it is in fact just cinnamon. But there are other supplements out there that, maybe are not as safe or well regulated. So I think we could probably talk all day about supplements. When we're on certain medications, though, we need to be really careful with which herbal supplements and remedies we're considering. And just because it's sold over the counter doesn't mean we should be taking it or it's safe to take. So always run it by your doctor and your pharmacist too. The pharmacist is a really good tool that can say yay or nay on that. But I would say in general, probably just not enough research to support the claims.
They say that, it actually lowers your cholesterol and, helps your blood sugars. And that's why they say you should take 1 or 2 tablets, or capsules, a day, put in your tea or.
Yeah, and there might be some studies out there to support that. Absolutely. And I think, again, it sounds like if it's just a cinnamon, it should be fairly low risk. But the other thing is, how could we, if it's the cinnamon truly that is helping with those claims, then maybe we could just think about how we can incorporate it into our meals, like adding it into an oatmeal or into a baking or something like that, rather than. The other thing we have to remember about supplements is that it is, it's $1 billion industry. So we have to be careful with some of these supplements too, because we can't believe all of the claims out there until we really know the efficacy. Yeah. Yeah. Well, Metamucil, yeah. So it's just fiber, though. That's where it's very straightforward, just simple. So also the other thing is that it's hard to get enough, to have enough research, right? There's not a lot of researchers out there studying that. So it's it just takes so long to actually, validate some of the claims out there. But yeah. Okay, fruits and vegetables. So nobody needs a dietitian to tell them eating fruits and vegetables is a good thing. We all know this and we always have. However, they often are the first thing that gets left behind, right? They are the thing that takes a little bit more prep, a little bit more planning. They go bad. There's a lot of reasons and a lot of barriers, right? They're expensive, lots of reasons. So fruits and vegetables, while we know the benefits of them, we still often find it challenging to work toward this half a plate and to get that in. But we do want to try and prioritize these foods, our fruits and vegetables. So the reason being, they are really protective sources of antioxidants, which really help with inflammation. So lots of vitamins, minerals, and again, fiber. So the more color that we have with our fruits and vegetables, the better. Really just trying to have a good diversity and a good variety with our fruits and vegetables can really, really help for a lot of reasons. Question? Yeah. Oh, good question. Yeah, I get this one often. So the question is something like carrots, or really any vegetable probably. Is it better to eat the vegetable or raw or cooked, or does it make a difference? No, it doesn't make a difference. Not one that is, maybe marginally. Maybe if you're boiling, really, really overcooking or boiling, then yes, there will be some nutrients lost, but you'll still get most of the benefits. So it's whatever you prefer, whatever you like, whatever you're more likely to eat. You may have some chewing difficulties that makes it difficult to eat some raw vegetables. Or if your appetite is reduced, it can be easier to have some of the cooked ones because they are just a little more, you can eat more of them when they're cooked. They sort of shrink up, right? Like a spinach might be easier to eat a little bit of cooked spinach versus a big spinach salad. So I think there's so many different, ways and reasons, but no, it in general does not impact the quality and the nutrition in the vegetables if they're cooked or not cooked. Avocados, yes, great question. So technically, yeah, fits into the fruits and vegetables category, but it is unique in that it also has a lot of heart-healthy fats in it. So it's got a lot of the similar properties as fruits and vegetables, like its fiber and the vitamins and minerals, but it has, it's kind of oily, right? So it's got a lot of good omega-3s. It's a really heart-healthy fat. So that's sort of the reason. We'll talk about that a little bit too, but that's where the avocados are healthy. So the question is there any value in cauliflower? I think if we're really, zooming in on which vegetable might be the best, yeah, it might rank a little lower than some of the more deeply colored ones, but there's still a lot of good benefits there in that it's high fiber. It's still got some vitamins and minerals in it. But yeah, I mean, they're not all created equally, but I would never discourage anybody from eating any vegetable. So I think if you like it, go for it. Yeah, and maybe just think about adding color in other ways. Yeah, so the question is, can you ever have too many fruits and vegetables? Yeah, too much of anything is probably not a good thing in some way, right? So I think the thing about eating too many fruits and vegetables is, are you eating enough protein? It's the same thing if you're eating too many carbohydrates, right? Are you getting enough protein? Are you eating any heart-healthy fats? Are you getting enough calories, right? I think eating too many vegetables can be a problem if we are experiencing unintentional weight loss or a loss of appetite, because those foods are very low calorie. They're not going to help us maintain our weight, right? Or gain weight. So I think, again, that's where, yeah, if we have meals that are vegetables only, probably raises some concern for me if it's happening often. Yeah. Question is, any difference between a red lentil or a green lentil, and any good suggestions on how to eat that tasteless stuff, to quote. Yeah, I think it's cooking methods, right? And it's what we're used to. It's I think if we didn't really grow up eating those foods, or if they're very unfamiliar, it's playing around with it a little bit. Yeah, I love to make a nice lentil soup. Super good. I often I think beans and legumes and things, they do go really well in cooked dishes, or adding them to a salad or something like that. Sort of, easing into it is what I would say. Sprinkling them on to something. There's also roasted lentils if you like crunchy snacks. You could try that. Yeah. Yeah, you could totally puree them as well. Yeah, lots of ways to get them in, but I think it does take some cooking skills and some time and some experimenting sometimes, just getting out of your comfort zone if there is something new that you want to try, which is easier said than done. So, Okay, one more question here, yeah.
You say choose a variety of colors. So with an apple, does the skin count or does the flesh count?
Oh yeah,
Are
absolutely.
all apples created equal, the various types, whether it's the crisp, the Granny Smith, Macintosh?
Yeah, I mean, there's probably slight differences in their nutrition value, but I wouldn't like worry too much about it. So I think the thing is, though, variety is important and having a diversity of the actual food. So yeah, choosing different fruits sometimes. So if you're if you're somebody who is only eating apples, that's your only fruit, I think we could probably get some benefits if we added in some variety with that. If we're able to, right? But yeah, the skin and the flesh are both good. Okay, so we know to aim to fill half a plate. So again, this is going to vary depending on a person's goals too, and on their needs, right? Like if appetite is quite reduced, again, that's probably a situation where maybe a half a plate of vegetables is a little too ambitious, and we might want to prioritize the protein foods a bit more and eat those foods first. Okay, now we'll go into fats, which I'm sure there will be some questions on. There's other groups that I do where we do a whole class on fats. So I'll go over it like super, basic level. But in general, fats are a good source of energy. They're very calorie dense, which can be a good thing or it can be a not so good thing depending on your needs. But they can be helpful if we have a lower appetite. Fats can help us to maintain our weight. And using heart-healthy vegetables or heart-healthy fats, such as vegetable oils, olive oil is sort of the gold standard, primarily because that's where most of the research has been done, is on olive oil. So we really have good, solid evidence to sort of support the benefits and the claims. But really, heart-healthy oils, olive oil has a lot of anti-inflammatory properties to it as well. Question? Yes, avocado oil is really great as well. So, and I think in comparison to olive oil, it's a little more mild. So it is better for cooking because it doesn't burn as easily as olive oil. So yeah, avocado oil is a really great heart healthy oil. We should add it to this actually, because it's a lot more available now. We have it pretty accessible. Yeah. Question is, why not eat the avocado or the olive instead? So absolutely, you will still get the benefits of those heart-healthy fats by eating the actual food. I think there isn't, it's not really should I do this or this? It's do both, right? Eat the avocado, and then if you're doing some cooking, the avocado oil can be a really nice, cooking tool. So I think both are good, but yeah, absolutely. Foods first is a good rule of thumb. So I think that's a good question to kind of bring us back to that, right? Because ultimately, a lot of these other oils and things, they're more processed compared to the whole food source. Really great question. Yeah. So could you use water or broth for your cooking instead of oil? Absolutely. Yes. So you totally can. However, if it's somebody who, again, with the loss of appetite or maybe some unintentional weight loss, we would want to use the higher fat content. So we would want to use oil, not necessarily deep frying or anything like that, but pan frying in an oil can help to add some really healthy calories to that meal versus cooking it in oil or a broth. So I think, again, and also it just depends on the meal, right? Some foods, some things that we're cooking are just not going to turn out if we cook it in water, right? And then again, in anybody who's maybe wanting to try something new, those oils could be a really helpful tool in increasing the taste and the palatability versus if, for an example, if you're somebody who wants to try eating fish or salmon but really doesn't like it, I think we wouldn't want to start with just poaching it. We would probably want to have some extra flavor and things in there to help us learn to like it. So there's so many variables, but there's certainly absolutely nothing wrong with cooking and steaming and more leaner cooking methods. Totally. Yeah. You are right. And thank you for saying that. Yes, absolutely. Canola oil is a really heart healthy oil. And I think there's some controversy on it out there now, lots of things with nutrition, but it is a very heart healthy oil, very accessible, very good for cooking. Yes, canola oil is definitely at the top of the list. So yeah, thanks for saying that. Oils for brain health. Yes. So I think if you've heard that before, it does come to the heart healthy oils, to the omega-3s. So it's the type of fat. Yes, there's some evidence to say that there's like cognitive health benefits from getting enough omega-3s. So it doesn't have to come from oil, but it could come from like fish and stuff as well. They have that type of omega-3, that heart healthy fat. That is now, there's some research to support that there's, brain health benefits to it too. Yeah, flaxseed. So fish also has heart healthy oils in it and fats. And then our nuts and seeds, they vary slightly. Fish sort of has the most optimal, like fatty fish like salmon and trout and herring. That type of fish has the most optimal type of heart healthy fat, which is our omega-3s. And it's a specific type of omega-3. So that's really the one that we do want to try to prioritize, but certainly nuts and seeds and avocados and the oils also have those heart healthy fats. So what about celery? No, 0 fats in celery. So if you like it, go for it. No nutrition. No, there is still nutritional value in terms of the fiber, really, and some vitamins and minerals. But it's a lot of water content, right? But it's something that we can include. Absolutely. There's no downside to eating it unless we're really trying to pack calories. Okay, so we'll move on to calcium foods. So this is, we want to include these throughout the day. We don't have to include calcium foods with every single meal, and we don't need to overdo it. It doesn't take much to get the calcium that we need. However, if you don't consume dairy products, it does take a little bit more effort to get the calcium in. As we know, dairy is the most optimal source, food source of calcium. So we'll go through that. Obviously we know calcium helps to keep our bones and our teeth strong. And it's a really important nutrient that I think saw a new research that I think it was around like 60% of people do not have adequate calcium intake. So pretty interesting, and to me, not surprising. Because I think a lot of people now just don't drink milk, or they don't, just eat enough of those calcium-rich foods. We don't want to supplement unless necessary. So again, same kind of message, but speaking with your doctor and your pharmacist if you are concerned about your calcium intake. So the question is there any calcium in oat milk? So yes, there's so many plant-based milks out there now. I think a lot more of them now are fortifying. So yes, hopefully, I think is not really a straightforward answer, but look at the label. Absolutely. If you're somebody who drinks a plant-based milk or prefers it, or for whatever reason, check the label to see, because that would be what we're missing, right? And we're missing in some of those plant-based milks, like oat milk, almond milk, there's a million of them, but it's missing protein. They're typically lower protein, although I have seen more lately that are higher. Lower in protein, they're not fortified with vitamin D typically, which regular cow's milk is. And then the calcium, of course, too. So, but a lot of them are fortified. So just check the label. There's, varying quality and lots of choices out there, like everything. So, good question. Yeah, so the question is, dairy is not on the Canada's food guide like it used to be. So there used to be a lot more emphasis on those dairy foods. So now they're lumped in with the protein foods, which makes sense. And then there's a note that just talks about calcium, because it's not about the dairy, it's about the calcium. So we can get calcium from other food. You can see in the picture here, we've got like our leafy greens are really good sources of calcium. And then like canned salmon with the bones that's a very good source of calcium too. And then like almonds, and some nuts. So absolutely doable to get calcium if you don't consume dairy. Again, it's just you'll get it a lot faster if you do. So it's it's a personal thing, but less sort of emphasis on it with the New Canada's Food Guide, which makes sense. It's I think I like the New Canada Food Guide much more than the previous version. I think a lot of dietitians would agree. It's just a lot more practical. Good question. Any other?
I see in your comment there that you say common COPD meds.
Yeah.
Like the inhalers. Is there something specific for PF?
So in terms of calcium loss or?
For pulmonary fibrosis patients, like some
Yeah.
may or may not use inhalers. Is
For
there
sure.
specific meds that,
Did you mean in terms of the calcium though, or?
in terms of reducing the amount of calcium, because
Prednisone,
Yeah.
for example.
Prednisone.
yeah.
Yeah. So I think, yeah, these are not, certainly it's not a one size fits all. I'm not exactly sure about like those specific medications in terms of the calcium loss.
Okay, because this is, I
Yeah.
think the majority of the people in this room do not have COPD. They have pulmonary fibrosis.
Yes, totally. So we'll go through some of the side effects for pulmonary fibrosis for sure right away. But in terms of calcium loss, I'm not sure. But definitely a good question for a pharmacist. Yeah.
Probably the prednisone. Some people might have to go on, or Debbie, do you want to speak on that?
Yeah, if your doctor puts you on prednisone, again, that will deplete your calcium, and it's a good time. They'll probably put you on a calcium supplement while you're taking your prednisone.
Yes.
Just like those puffers are referring to one with steroids in them. Same idea.
Yeah. Okay. So vitamin D is the next one we'll go through. Again, works in partnership with calcium to help keep our bones strong. Lots of good benefits to getting adequate vitamin D as well. So these supplements are widely available, pretty inexpensive and well researched as well. So again, the guideline on the slide is for COPD. So I think, but yeah, in general, for adults 50 years plus, we want to aim for 800 to 2,000, which is kind of a wide range. But yeah, it can definitely help with the calcium absorption too. So typically in our climate, we do generally benefit from the additional vitamin D supplementation. Okay, so we'll move on to other foods. So we kind of talked a little bit about this, but what about the other foods, the processed choices? So we're human, right? We eat for more than just nutrition. So these foods can fit. All foods can fit. Sometimes we're eating for fun and socialization, and that's okay. Again, if we have a reduced appetite, sometimes we just need to eat what we want to eat. And we have to look past nutrition sometimes too. Or we have to look past the choices that we sort of should make, right? And we just enjoy some fun foods within reason. All right, so fluids and hydration, we want to keep our fluids up as well. Help to keep secretions thinner, help to manage our digestive health and reduce constipation. So aiming for 6 to 8 cups of non-alcoholic liquids per day. Okay, and then eating well, so it goes beyond just nutrition, as I kind of talked about. We want to eat, like meal spacing and meal timing is something that I talk a lot about as well. So aiming to eating 3 meals a day isn't like a must. You have to do that. I think that's different for everybody, but certainly, again, if we're managing like a reduced appetite, we sort of want that window of eating to be a little bit wider so that we can do the small frequent meals if we're filling up quite quickly. And same goes for good blood sugar management as well. We want to try to space that out. So it also, eating more times and more meals throughout the day also increases the variety of foods that we're going to have too, right? Versus if we're just having 1 meal or 2 meals, it's a little bit more tricky to get the nutrition that we need, and we're likely to have, a reduced variety as well. Any questions on this? Yeah, so the question is, like a pizza with a cauliflower crust, is it a better option, and would it be sort of considered into a fun food? So I think the thing about I like to look at those foods, like you see like the veggie noodles or like the cauliflower crust. I think it's a nice way to get more vegetables in, although like there's such a wide variety. Sometimes it says cauliflower crust, but really that's like this much cauliflower and it's still pizza. I mean, at the end of the day, eat the pizza that you like to eat, right? I think it's still, no matter what, even if it's a cauliflower pizza, it's still pizza, right? It's still got cheese. It's okay to have. That's the message, is eat the pizza, and maybe pair it with some vegetables on the side if you feel up to it, or just enjoy. So now we'll get into some strategies here. So how to make meals easier. So I could spend a whole hour talking about this slide in general, but and about meal planning and meal prep. But some quick tips here are to batch cook. So when your energy is good, when you're feeling like you've got good energy and you can, or when you have support, when you have extra help, cook extra. So batch cook. Choose meals that you can make extra and maybe freeze. Is also can be helpful to have some additional pre-prepped meals on hand. Could be frozen dinners. There's a good variety of those too, and not all of them are like high fat, high sodium. Some of them are for sure, but there's also some healthier options out there now too. And I think it's a tool. It's like to have something in the freezer accessible so that the meal doesn't get skipped. When you are feeling like you don't have it in you to prepare a nice home cooked meal. So having just tools and having options to fill the gaps when you don't have high energy. Meals on Wheels, or there's lots of different meal delivery, like meal prep delivery supports out there now too. Another one that's local in Winnipeg is Food for Thought. So they do sort of similar to Meals on Wheels, but anyone can order them. You don't have to meet any certain criteria. So that's another tool. Or ordering groceries to help preserve your energy. I know that's something that we talk about with this group as well, is conserving energy. So I think not going to the grocery store if you don't have to is a way to do that, right? Ordering your groceries in or picking them up or getting the delivery, but that's definitely a way to sort of save some energy that you can sort of better use later. And then if you do need a little bit of extra support with access to some affordable foods, there's certainly our social worker can chat with you about some of that. Certainly options there. Any other questions on this? So now we'll go through some of the challenges when eating can be difficult. So we've talked about this kind of throughout, but some common challenges are just, again, poor energy, fatigue, just chronic fatigue, that can impact our ability to eat enough food and to, can impact our appetite. Shortness of breath can make it difficult to get through a meal. Bloating, and we'll talk about some of those side effects, again, loss of appetite, but digestive health side effects like nausea, heartburn, constipation, bloating. We'll go through some. Yeah. Swallowing. Okay. Yes. Exactly. So we'll go through some strategies, but just for sure. Thank you. Yes. Loose stools, diarrhea. Yeah, absolutely. Okay. So we'll go through some of those strategies. So in general, with a lot of the digestive health strategies or symptoms and side effects and reduced appetite, small meals more often. So just, spacing your meals not too far apart, but having a wide enough window so that you can have the opportunity to get the meal in. Eating your bigger meal earlier in the day when you are feeling, or whenever you feel most energy. Maybe that's after having a rest, but eating that bigger meal when it works for you. It doesn't have to be the traditional, in the evening is the biggest meal. I think it's whenever it works best for you. Starting with solid foods first. So eating your protein foods first. Also, even sometimes when we have a poor appetite or we're filling up quite quickly, we can even fill up from fluids like water. So just eating your meal first and then moving on to the fluids after. And then, just taking your time as you go through it. So fatigue, resting before eating if you can. Try to have a rest before your meal. And then choosing soft foods too, foods that are easier to eat, right? So if we're feeling fatigue or chronic fatigue, we don't want to reach for something like the celery or the salad or something that's like a steak or something that's really hard to chew. We want something soft, that we can eat, maybe like a smoothie or a soup, something that we can that's easier, right? It's lower effort to eat. And if you do use oxygen, you can wear it during your meal as well. If you have shortness of breath, and for anybody really, like, good posture is important in reducing risk too. So trying to maintain good posture, and that can help as well. And then if loss of appetite. So this is where sometimes it's always nuanced and individualized, but when someone is really struggling to get their intake up, we just have to work with that individual, and you have to sort of know maybe what food triggers are, kind of like contributing to your symptoms, right? So we have to know work with what you enjoy. So again, and sometimes people might be concerned, well, I was always, for the past however many years, I haven't been eating, bread because of my blood sugars, but that's actually what I really like. Or like, I try to stay away from fast food, but if that's what you really like right now, sometimes when appetite is so poor, we have to just keep in mind that calories are important. We need to get the calories in, right? To be able to prevent any unwanted weight loss. So working with your favorite foods and sort of playing around with flavors and things too. Sometimes people want really bland meals, and that's okay. Sometimes a little bit of extra flavor might help. So I think it's so personal too. Supplements, definitely. Oral nutrition supplements. We kind of talked about fiber supplement. We talked about a protein bar, protein supplement, but these ones are more like the Boost or Ensure. So they're more of a complete nutrition supplement to help bump up your calories and protein and to help prevent the weight loss. So those, again, can be really helpful tools. We ideally would have them sort of spaced out throughout the day because they'll fill you up. So we don't want to have a boost right before lunch or right before our meal because it's going to take away from that meal. So a really good strategy is to sort of take the supplement and kind of split it up throughout the day and have it like in between or after meals, just a small amount kind of spread out, and that can really help to bump up your calories too. And eating your protein foods first as well. And then, a meeting with a dietitian can also really help, so we can do some more like customized planning and just see what gaps there might be and where we could kind of focus our efforts. Okay, so diarrhea, another challenge side effect. So by some medications that you might be on, diarrhea absolutely can be a side effect. So maintaining good hydration, of course, because when we're having diarrhea, if that's persisting, then our hydration is at risk. So we need to make sure we're keeping that up by drinking fluids, whatever kind of fluids that you prefer. Ideally, it's a lower sugar fluid, but ultimately, if there are no if there are no major blood sugar concerns, really any fluids that you're willing to drink to help get your hydration up is fine. And then after experiencing diarrhea, if it starts to resolve, sometimes what happens is we go sort of from one end of the spectrum to the other, where it's diarrhea and then it sort of evolves into constipation. So we want to slowly increase our fiber intake so that we can sort of prevent that from happening, that fluctuation. Knowing your triggers, everyone's triggers are different with food and related to which type of symptom they're having, but kind of being aware of what foods are setting you off. Often they're the high-fat meals, right? Foods that are really, really high in fat or fried, those foods can trigger some of those undesirable digestive symptoms too, or they can definitely make them worse. Spicy foods, really sugary stuff, alcohol as well. And then constipation, like I said, so we want to focus on fiber and fluid, but we do want to be careful with fiber. If we add too much at once, or if we decide to supplement but we add too much at once, that can end up resulting in diarrhea. So we want to be careful. We want to just slowly increase it, progress it slowly, and make sure we're drinking enough water. And movement will also really help to manage constipation too. So those three things together can really help. And then another reason why like small frequent meals can help is also for our digestive health. So our bowel routines do better with small frequent meals versus sort of one or two really large meals. Any questions on So heartburn is another one that we'll go through. There's some common triggers for heartburn, food triggers for heartburn as well. Citrus, tomatoes definitely, or tomato sauces, high-fat foods definitely as well. So again, sometimes people have really individual kind of unexpected triggers though, so it does take a little bit of, mindfulness to kind of just be aware of what might be setting you off. But caffeine is another common one. So if you experience heartburn, just making sure you're not laying down after your meal and stay sitting up for a little bit. Bloating, so many reasons why bloating can happen, and it's not always, bad. It's not always, if it's not causing pain or, any discomfort, then it's not always a bad thing, bloating. Sometimes it's normal. But if it's something that's recurring and it's sort of, maybe there's some discomfort with it, then there are definitely things that we can do diet-wise to sort through that. Okay, so weight. I think that, the main message here is that your body weight is unique to you. So it's important to notice any drastic changes in one direction or the other, any real quick, unexpected, unintentional weight loss is absolutely something we want to be aware of and kind of catch sooner than later and try to intervene. But yeah, big changes in weight can often correlate with a sign in your health. Or a change in your health. So yeah, keeping an eye out for a low appetite and appetite changes, taste changes with medications as well, really common. All right, and yeah, we kind of talked about this throughout, but different reasons why you might consider doing an individual assessment with a dietitian. We can kind of work together to do some planning on your diet and just sort of figure out some meals with regards to whatever your specific sort of challenge or goal is. And then, in summary, nutrition is important in maintaining your strength and your energy, preventing and managing infections and recovering from infections and wounds, and just helping to promote good immunity as well. And then definitely food can play a role in your side effects management too. Okay, any other questions? Fermented foods. Yeah, so the question is, where would you fit fermented foods? So there's a lot of new research and new findings in the gut health, the digestive health area, which is so fascinating and really, really cool, actually. So fermented foods, definitely that's sort of the link, right, related to gut health. So I think the benefit of them is that they have the probiotics in them. So they can help promote the growth of or help optimize our gut bacteria, which is really important, and also sometimes some kind of explainable like gut health symptoms, right? If we're having, or if we are suspecting some food intolerances or like bloating and diarrhea and things like that. So really interesting. So those probiotic foods definitely are helpful to add in and just to see, like, is this helping? And you don't need much of them, but I would absolutely suggest to just add the foods and not go the supplement route with the probiotic unless your physician recommends. I think there are lots of things we could try to improve gut health before trying the probiotic. We still just don't have enough research to say like if those are beneficial or not. So yeah, good question.
So you could just name them. The foods, not the supplements.
Oh, name the foods. Yeah. So some fermented foods. Yeah. So things like sauerkraut. You can find probiotics in so many different things. Kimchi is another one. Like, there are things that we, take a little bit of like thought to kind of implement, but again, you don't need much of them. The yogurt too. Yeah, totally. So,
Certain cheeses, but not all cheeses.
for the probiotics. Fermented dairy too. Yeah, so not all cheese would be a source of a probiotic or a fermented food. But yeah. So the question is, any evidence on probiotics helping with acid reflux? So good question. Not that I'm aware of. I think so far the only like really evidence-based sort of use of them right now is like if maybe you had been on antibiotics for like long term, then there's some evidence to say that they could be helpful then. But yeah, I think it's very emerging area that's really cool. And I think, yeah, lots of good findings are coming from that. But yeah, I'm not sure specifically that link. Yes, good question. So at the wellness part, like a small part of my role is in the pulmonary rehab program, but then the majority of my role is more in the fee-for-service setting there within the clinic. So a lot of plans do cover dietitian services. So I think the wellness charges $130 for a dietitian appointment there for a 60-minute assessment. And then we can do follow-up from there. But there's a bunch of different programs that they have. So I think, certainly their website is a really good resource for all the services that they have. But and they'll do direct billing at the wellness. So but definitely check your benefits plan, because a lot of them do cover dietitians.
And certain doctors' clinics have collaborative care where they have dietitians available to you. So check with your family doctor and see if your clinic has anything like that.
Yeah, that's a great point. Thanks for sharing that. So there are dietitians like through the access centers at within the WRHA that you can also be referred to by your doctor. It just requires a referral. Not sure what the weights are like or if there's certain criteria. I don't know. There's also Dial a Dietitian that's available in Manitoba if you have like quick questions. They are really good with like directing you to the sort of appropriate person or the maybe like a credible website or something like that where you can find the answers to your question. But it's a good resource in Manitoba too. Yeah, so the question is a slice of 12-grain bread compared to a slice of rye bread. So everybody loves their like Winnipeg rye, right? But it is a little bit more of a refined, lower fiber choice compared to the more grainier type bread. So it's the fiber that will be different. So a lot of those rye breads are made with just the white, like wheat, right? There might be a little bit of rye in there, which bumps up the fiber a tiny bit. But I think, again, it comes down to like, do you have to choose the 12 grain? No, you don't. We can certainly get our fiber from somewhere else too, if that's something that's really important. I always like to ask my clients, like, what's your like non-negotiable thing, like food wise that you aren't really willing to change? And we sort of sort through that and try to figure out how to find the right balance, right? So, we don't always have to choose the best option. We have to be able to be flexible. So, yeah. Sourdough breads are not technically as high of fiber as like the grainier breads, but again, it comes back to the glycemic index too, which I talked about before. So it's just like comparable to the sweet potato versus the potato is that the sourdough bread doesn't impact our blood sugar as quickly as the white bread. So it's better from a blood sugar perspective, but still not going to pack like a ton of fiber. Greek yogurt, where does that fit in? And what are the benefits? So Greek yogurt it's much higher in protein than a regular yogurt. So that's sort of the difference between just an ordinary yogurt or maybe like a probiotic yogurt compared to a Greek yogurt, is that the Greek is much higher in protein, which is great. I think it's an easy food. It's accessible for most. It is a little more expensive though, compared to the regular yogurt, but it's higher protein. So the benefits are the protein and the calcium.
Just this week, I saw an endocrinologist about calcium needs and bones and that kind of thing. Mm-hmm. Surprisingly, the information she gave was that Greek yogurt higher in protein, but lower in calcium.
Okay.
So I was really surprised to learn that.
Yeah.
The information pack she gave.
Okay, interesting. I think that's the thing. You got to look at the label. They're all so different, right? Because there's so many different brands and they all slightly vary. But that's something you can definitely look at the food label for is the calcium. It will be on the food label too. Yeah, but that's interesting. I didn't actually see that, but.
Well, it would make sense because if you make Greek yogurt, you extract the whey that's in it, and the whey is like milk. It's what has all the calcium.
Right.
Yeah. I make my own yogurt. So.
Wow, that's really cool. I am by no means a food scientist, but that's cool. Okay, any other questions? Okay, great. Well, thanks for having me.
Thank you so much, Jill. That was absolutely excellent. I loved all the questions everybody had, and thank you for coming, and I hopefully see you again soon.